We're so fortunate in our community to have a very robust healthcare infrastructure. We've got medical schools, we have nurse training programs, we've got hospital systems, we've got physicians. JPS is central and core to that infrastructure, that entire ecosystem.
John Peter Smith always does things with quality, and they do things with care.
But I think until you've had an experience within the system, I don't think you truly have an appreciation for the level of work, the level of commitment, and what people do here on a daily basis.
The care here is very compassionate. Patients don't necessarily expect to be treated that way, but we go above and beyond just to make sure that the community is served well.
Our current population is about 2 million. They anticipate that over the next 20 years, our population is going to increase by an additional 1 million people. Healthcare is going to be extremely important because not only are we going to grow as far as population is concerned, but the makeup of that population is going to change dramatically.
The role that JPS plays, it's a partner with the other healthcare providers in the county, the other hospitals, the physicians in the county, the training programs we have for physicians. So JPS is more than just a safety net. It is that, and that is very important. But for tens of thousands of Tarrant County residents, including me, it's a medical home in the truest sense.
Its outpatient system is huge, and patients are able to access that very easily now.
And there has to be a leadership group that steps up and brings all the disparate parts together. And JPS is playing that role. And through our analysis with the Blue Ribbon Committee, we are going to be recommending that JPS take the lead role in that. JPS has and needs to continue and actually have a greater presence in providing leadership so that we can coordinate the limited resources that we have to approach a problem that is constantly growing.
The need is great.
One of the challenges is that from a behavioral health perspective, it is not one of the well-reimbursed services. It's not one of the glamorous services that's being delivered in healthcare, and so it doesn't always have the resources and support that it needs.
I think sometimes people think about JPS, they tend to think about a hospital building. If you walk the halls of John Peter Smith Hospital, you realize that it's the people that's truly JPS. So not only are we going to need facilities, but more important, maintaining the great individuals we have and the quality they provide to healthcare in this community.
When you look at JPS, and if you look at the expansive nature of JPS and what they actually provide to this community, you simply can't do that from tax dollars alone or from medical insurance payments alone. You need a philanthropic group that continually supports this, because regardless if you think you're going to need it or not, take my word for it, you're going to need a doctor, you're going to need an emergency room, and you're going to need an adequate hospital facility that's going to make you well.
To all our employees across all of our 60 locations, what they do every day, in and out, 24/7, 365 days a year, we're proud to say we are the safety net hospital. But more important, with our teaching and with our trauma ones and with our school-based clinics, with all our specialty clinics, we do so much more across the entire county. And that's what I'm the proudest of. I'm proud of our people, and I'm proud of what we deliver every day to this community.